Everybody. My name is Katie Devine, and I'm going to be talking a little bit today about the role of technology in cancer care, especially among our adolescents and young adults who are really the digital generation. Before we start, I just want to tell you a little bit about myself. I really appreciate Matthew's talk earlier, bringing me back to my childhood times as well. So you can see this picture here. I'm all the way on the left, rocking some rollerblades and some awesome colors there. And those are my two sisters, Christy and Carrie. You might notice that Christy's sitting in a chair. She's got some crutches off to the side. She is a long-term survivor of osteosarcoma diagnosed as a child. And so she had a limb salvage procedure. You can see her leg is in a brace there. So she is able to walk and is thriving right now, but she is the inspiration for the work that I do and the reason I became a psychologist and work in cancer survivorship. I've seen, she's doing really well in life, but survivorship is difficult and there's lots of ups and downs, and so she inspires me to do this work. So today we're going to talk a little bit about how technology is being used in cancer care, especially by our adolescents and young adults. I will probably use AYA also interchangeably, so I know you're all familiar. We'll talk a little bit about the pros and the pitfalls of technology and how to help our AYAs identify the best, most reliable sources to access. So I actually just saw a great talk upstairs where they had the same Institute of Medicine figure. So we know that cancer affects adolescents and young adults in the United States. Earlier today, we also heard about the numbers, but it's about 10,000 new cases in children up to the age 14 and a little over 84,000 in AYA ages 15 to 39 in the United States. And there are over 500,000 childhood cancer survivors in the United States, even more adolescent and young adult survivors, and about the same amount worldwide. So about 1 million childhood cancer survivors worldwide. And what's so important about survivorship, as we heard earlier, is that these survivors are at risk for late health effects, secondary cancers, and chronic illness at high numbers. So depending on your source of information, anywhere from 2/3 to 99% of our childhood cancer survivors go on to develop at least one chronic health condition. And that 99% is really from a clinical ascertainment. If they go back for a checkup, inevitably they're going to find something that is a result of the treatment and the cancer they had as a child. And we know that, especially for adolescents and young adults, a cancer diagnosis can really disrupt all life domains. We heard a lot earlier about that identity development, self-esteem, body image, relationships, and not only what's happening right now, but for the future. Well, thinking about future finances, future fertility, future family planning, all those things. And so it's really important that we find ways to support adolescents and young adults at the time of diagnosis all the way through survivorship. Now I'm talking about technology, so I'd be remiss not to mention just how ubiquitous technology is in our lives today, right? Everyone, raise your hand if you have a cell phone here in this room. Who's online? Who's online right now? Yeah. So just like us in this room, our adolescents and young adults are online all the time. On the left side here, you see just the recent Pew data. They do surveys pretty much every year where they are looking at trends in technology use. And you can see this is looking specifically at teenagers. So it's the percent of US teens who are between the ages of 13 and 17 who use these social media platforms. You can see YouTube is at the top right now with over 90% of youth endorsing using YouTube. Then you see TikTok, Instagram, and Snapchat coming together. And then following Facebook, WhatsApp, other places. Facebook is our teens kind of refer to as like the old people social media. So it's probably what all of us are on, but these are what the teens are accessing every day. And when you ask them how often they're online, you can see the bars here on the right. The darkest color at the top is almost constantly. The next color is several times a day. So back about 10 years ago, it was about 24% of youth said they were online almost constantly, but 92% were between that and about once at least daily. And now 10 years later, it's actually been pretty consistent the last several years. It's 46% say they're online almost constantly. That is a lot of time that they're spending online. And very few people are saying less than daily. So really, this is having a big influence on what they see, how they're responding, their psychological and emotional health. We've also all seen the headlines about social media influencing teens in negative ways, especially for young girls. And so, we want to think about, for our teens who have cancer, how is this affecting them too? And so we look to the literature, we talk to young adults about how are they using technology throughout their cancer continuum. So we think about cancer continuum from symptoms and diagnosis, through treatment, and through survivorship or end of life. And there's lots of ways people are using technology in these domains. So first and foremost, people are Googling, right? Usually before diagnosis. They're coming in, they've had symptoms for a while. We heard earlier about how there's often delays in diagnosis for AYA, but they've been experiencing symptoms for a long time. So they're using Google, they're trying to figure out what's going on with them. Then once they're diagnosed, they might use Google to find out what the heck that word is. We've never heard of it before. And also looking at prognostic information. So what does this mean? And we'll talk a little bit later about this, but it's difficult when you see those numbers. People often have a really difficult time interpreting those statistics. And really, often what you can find online are 5-year survival rates. And those are an average over, all people diagnosed with that disease. But we have a young adult who is one person, right? And they're trying to figure out, what does that mean for me? So if the chances are, 80%, am I in that 80% or am I in that 20%? And so it can be really scary to see those numbers online, especially when they're not as high as the overall average for other cancers. Also, young adults use technology to explore, what are their research options? What treatment decisions do I have? Now, one of the great things that has been implemented in recent years is clinicaltrials.gov. So it's open to the public. People can find information about clinical trials available to them all over the world. And people actually do use that to look up information and options that they might have for their particular cancer, and might try to seek out different institutions to go get treatment if they're not open at their own institution. Another big thing that we hear AYA talk about is using technology to tell other people, either to ask, how do I tell other people about my cancer diagnosis, or to actually put that out there, and using either social media, or maybe they're sending mass email to their contacts, but using in different ways to disclose their diagnosis to other people. Through treatment, we also see the use of technology in practical ways. So one of the nice things that has come out of COVID is the increased use of telemedicine. It's really a nice way to meet people where they're at, so they don't have to have the burden of travel into a cancer center to have some of these visits, especially visits that don't require a physical checkup. We also see our support services have used a lot of mental health services through telemedicine, making it easier. And what we find, a lot of our AYAs like it. They feel more comfortable in their own home instead of in someone's office. And if they're comfortable with the screen, they can really kind of relax and even share a little bit more about their world with their therapist. They might say, like, hey, look at this artwork that I have in my background. It's something that's important to me. And it makes sometimes it makes it easier to develop deeper relationships in these therapeutic relationships. Also, during treatment, symptom management is a huge burden. And so they might be using the internet to find out ways to manage symptoms. There are lots of mobile apps available now to help people track their symptoms, as well as adhere to medication. Some of our AYA will require to take various types of medications at all kinds of days and times. And so they can use their cell phones for reminders. They can use different systems to track that too. Also, it's a great way to share information with others. There are actually platforms out there like CaringBridge and others where they have made it easier for people to use technology to spread it out to their trusted friend network. We heard earlier too about designating someone who might be their point person to do that sharing for them. So it removes the burden, but then is like a convenient way to get information out, and the same information to people. So there's not as much room for the telephone going awry as they're trying to share the information about themselves. It's also a great way to access practical resources. There are a lot of resources out there. Crossroads for Hope offers a number of wonderful resources, and people might not be aware of it unless they start to use technology to try to access that and to find those services near them. Also, getting them keyed in on other financial resources, scholarships, and things like that. There's lots available online. We mentioned before the idea of online support groups and communities, and it's a really nice way to foster meeting people, especially for AYAs. Although the numbers are striking, it's still relatively rare. We heard earlier it's 4 to 5% of all cancer diagnoses in the United States, right? So that's actually not that many people. Most of our AYA don't know another person in their regular social network who has the same experience. So this allows them to connect with others with a lived experience, a shared experience, and someone who can understand what they're going through. We also think with technology, one of the things, especially with our young male AYA, is gaming. Gaming is a great distraction, is a great coping mechanism, and what we have found in recent years, it's actually a really great social tool. Many of our young males are using gaming as a way of connecting with their friends. That's what they do. They go online, they talk trash, they do fun things, and it's a nice way of them feeling normal and accessing their peer network. And also many AYA take to blogging or video blogging about their experience, a therapeutic way of sharing their story. I know earlier some of the resources that were put up there with Elephants and Tea and other Cactus Cancer Society, they have some actually workshops on helping people who want to do that kind of thing, do it in a way that feels right to them. And so it's a great resource if someone's interested in that to access it. And then through survivorship and end of life, there's actually lots of tools online for advanced directives. So there's a lovely program that Lori Weiner and colleagues at the National Cancer Institute have developed over many years called Voicing My Choices, helping AYA think through what is important to them in their end-of-life care and helping build their legacy that they'd like to leave, and even thinking about things that are very difficult to talk about, like planning your own funeral and how you'd like that to go. And so these tools can be available and actually maybe are a little bit easier to do as someone's walking you through it instead of maybe even talking through it sometimes. There's also lots of digital legacy building tools so people can leave their mark. In survivorship, we also think of mobile apps and digital tools for health promotion and leading active lifestyles. So you think about wearables, all the mobile apps for fitness, nutrition, sleep, you name it, there's an app for it. And so these we find a lot of our survivors accessing and using these apps. And then, of course, for electronic health records are really helping us build interoperability between different cancer centers. Communication is a major issue, and sharing your history with another provider is a big deal and can get really old and frustrating for our survivors. And so using digital health records to be able to share that information more easily, I think it's only going to get easier in the future. It's still a challenge between different healthcare systems, but the idea is that it really can help make that a little bit easier for our AYAs going forward. So what is the power of technology? It's really the biggest thing, and we hear this from our AYAs all the time, is connection, right? They feel so isolated. They don't know anyone else getting this diagnosis. They may be actually physically isolated from the rest of their world. And technology can allow them to connect in a way that they wouldn't be able to otherwise. You think about 20 years ago, treatment, if someone was in the hospital for a month, they had no way of reaching their peers, their schools. But now they can actually stay connected through this to their networks. They can keep up on their schoolwork, whether they want to or not. And really, it's a way for them to feel that their life is still theirs in some way. They also have so much information available to them that was never before. Thinking about information about diagnosis, treatments, helping them make decisions, helping them learn about side effects, ways to manage side effects, and access to so much more too. Access to services, access to practical resources. These are really things that, we can harness this for really helping people deal with the many challenges of cancer care. So let's talk a little bit about the pros and cons. One of the major things as we're thinking about connection is really that emotional support and community building. So AYAs have the juxtaposition of sort of wanting to really identify themselves and be different and unique, but at the same time totally fitting in with everyone around them, right? And cancer makes it almost impossible for them to feel like they're fitting in. And so here they can find other people like them who've had the same experience. And it's really a very powerful tool. We actually use it a lot in our work. It's harnessing the peer shared experience and just feeling heard, and almost like you don't even have to talk about it, but you just know. And it's just so helpful. It feels so supportive, and you can then, talk about things in ways you couldn't with someone who doesn't have the same experience. It also allows them to connect with their non-cancer peers, right? Just keep up those social relationships. Online forums actually also offer a really nice anonymous way sometimes to share information. It can make it easier to talk about challenging topics, thinking about particularly some of our side effects that are difficult: body image, sexual functioning. Those might be easier to ask people about in an online forum than to ask your best friend about. And the anonymity makes it almost easier to just put yourself out there. It also really allows our young adults to participate in social activities even when they're not well. So maybe they can't go to the social outing, but they still can call their friends afterwards, see how it went. And there's a way for them to still relate to others, even if they're sort of isolated to their home or to the hospital setting. This, I think, also in terms of engaging with therapeutic services, they can also do that and do it from the comfort of their home if it's on a telehealth. And if they don't need to be on video, it actually allows them the flexibility of participating without being seen, which is a nice way, I think, for some of our young adults who are concerned about the way they look. They'd rather be just talking with people instead of having their video there. And then they're looking, concerned about, oh, my face is all puffy and I don't want to do that. But if you can keep the video off and still connect in other ways, or through online forums where it's more text-based connections, it can overcome some of their concerns about body image. And as I mentioned earlier, it's also a nice distraction, just keeping up with others, engaging in normal activities, things that they would be doing if they didn't have cancer and weren't being treated. It's a nice way of just engaging in regular life. It also gives access. So access to information. You can find so much information on the internet, more than you ever wanted to know, probably. And there is a lot of good information out there. So there's a lot of helpful medical information that would allow you to become more informed about your condition and treatment options. There's also lots of organizations like Crossroads for Hope and others, Stupid Cancer, that offer online webinars and other really educational information for folks that we know is great quality and very helpful. It also empowers our adolescents and young adults to take some control, learn about what the options are for them, and feel like they are educated and knowledgeable and can take that and make that decision themselves. It gives them a little bit of autonomy that otherwise it feels like it's being stripped away in this circumstance. In the realm of symptom management and health promotion, we have lots of great online forums, virtual reality apps that help you track and address physical symptoms, mental health. Virtual reality is being used in a number of contexts. It's really been very successful in the context of pain management, either undergoing procedural pain or more chronic pain, where it's a wonderful distraction during procedures and also helps people stay relaxed and calm during these types of sessions. We're also seeing it recently used in social ways. So there are some researchers at Yale that are using virtual reality support groups. So you don't go to the support group, you actually wear a headset and your avatar is participating in the support group, and it mimics what you're doing. So you're actually, like me, if you talk with your hands, you're talking with your hands in the support group, but you're sitting in the comfort of your own home. And so there's some interesting sort of novel ways technology are used to help connect people. It's also really convenient, right? One of the things we know about adolescents and young adults is that they're super busy. They have busy lives. They're trying to keep up those busy lives. And it's difficult for them to make time sometimes for these supportive care services. And if they're only offered, at the hospital during 1 hour on a Thursday, that might not work for many people. And so these digital options give more flexibility. They can be accessible 24 hours a day for most of them. And it's really, it's actually sometimes a nice tool. If they wake up in the middle of the night worrying about something, they can access something that might help them deal with that at the moment. And we see technology becoming more and more a regular feature of our cancer care. Like I said earlier, telemedicine is a wonderful method that we use for virtual consultations. It allows cancer patients to access specialists and supportive services without the burden of travel. It also allows for like our longer term survivors to have consults with their prior cancer center treatments, even with their primary care. There's some work that was done mostly in the UK that had a consultative model where the primary care and the oncologist would get on a Zoom meeting with the patient to help that transition from oncology to primary care. So there's ways that our providers are using it to make life easier for everyone. I also mentioned already that the electronic health records are really helping to facilitate the transition of information, especially for our adolescents and young adults who are treated as children. They were not the keepers of that information. The information went to their parents, and then at some point it needs to come to them. And so having these written summaries that can be in their health records allows them to have access to the information and to share it with new providers too. Also, most of the new electronic health records allow for patients to email their providers with questions that are not urgent. And so I think our adolescents and young adults, especially if they have questions that maybe are a little more sensitive or they're worried about asking, as long as they're not urgent, they can be encouraged to use those features to communicate with their providers. And also really the proliferation of mobile health apps. So there are many apps out there that can help people with healthy lifestyles. I really think we're also seeing more and more in the mental health space and having these digital apps where you can access a therapist right through your phones, and they're not as long waiting lists. Many of our mental health professionals have very long waiting lists right now. And so sometimes these digital platforms have a lower wait list because it's easier for people to get in. And so it's a nice tool to either to use for a service or even as a stopgap as they're waiting for other therapeutic services. But of course, technology also comes with a side, a pitfall, right? So one of the biggest challenges with technology is misinformation. So this is the idea that information can sometimes spread myths, misconceptions, or outdated information. And you can see here just a picture of a few headlines here that would probably make some of you cringe, like women's cancer cured with household spice. I don't think so. The 50-year-old man cures lung cancer with cannabis oil. So there's lots of this information out there online, and it's easy when you actually are Googling it that some of these things might rise to the top. And especially actually one of the pitfalls of social media platforms is that they have algorithms that try to show you information that they think you like, and they're trying to tailor it, personalize it to you. So if you accidentally click on one of these, or maybe someone sends this to you, you might then get 20 articles about the same type of thing. And now that the numbers start to make you think, well, maybe this is something believable. And just that, the sheer volume of things you see about it might, help or make it harder for our AYAs to figure out what is correct and what is, misinformation. Here's another example of a Reddit post that the original post was basically saying how they were going to just heal their cancer naturally and not do any chemo. And so here is an example of a response from someone who was a survivor who was trying to dissuade them of that and say, I understand where you're coming from. I was lost in the beginning when I was diagnosed, and I tried watching videos about healing your cancer naturally, but I decided that I really had to go with chemo. It really wasn't that bad, and it helped me. And so I think you see all over these places, there's the opportunity for information to go awry, and hopefully there's some sounding boards and people who are trying to spread the right information, but it can be challenging to overcome. The other aspect is the distress that people sometimes feel in response to seeing these social media posts. And so you can encounter severe or negative reactions of others when you put yourself out there. I think Matthew said it earlier really, well, that when you put it out there, it's out there permanently, right? And someone is going to respond to it. And at least there's inevitably going to be someone who's going to say something that will make you feel bad if you look at that comment. And it might also spread anxiety or fear. Here are some examples that we have from some published literatures. Here's a positive one. The whole social media aspect kind of makes it harder, because while it's entertaining to pass the time, it's hard to see people just living their lives and being able to do normal things. So the idea of comparing yourself to others and seeing what you're missing out on, I think, Kyle said it beautifully earlier, that FOMO is real when you're looking at it. And then you also open up yourselves to people, who don't know how to respond, especially our AYA peers have probably not dealt with another young person in their life having cancer, and they don't know what to do about it. They don't know what to say. Some people wind up not saying anything at all, and that hurts usually the cancer patient. And then some people say really stupid things, and that hurts them too. Here's a good example someone told us about. I know what you're going through. My friend was diagnosed with breast cancer and died within a year. It was so sad, but I'm sure you'll be fine. It's like, that is not what you want to hear when you're first diagnosed. And then another aspect we hear a lot from patients is this idea that they have to be positive. They cannot say anything negative, or people believe then that you can't get through cancer without being positive. So they hear people say, like, you're so brave. And it's meant from a place of of admiration, a place of trying to compliment the survivor. But then the survivors often feel, well, then I can't not be brave. I can't tell them how scared I am. I can't share how distressing this is. And it's almost an element of coming or causing a toxic positivity, where if you're not positive, then people start to getting on you about it. And so it really, in our society, it can be difficult. And that's why actually I think seeking out support services with therapists, nonprofit organizations is really helpful, because they can find a space where they can share those fears and not feel like the answers be like, oh, you can't say that, you have to be positive. And so it's nice that there are services available where they can share that, and they might not be able to share it with their own support networks. The other piece is that some of these websites there are certainly privacy and security concerns. So sharing your personal health information in online forums is permanent, right? And there's not a way to erase that if it is a public forum. So it may pose risks to their privacy. For our AYAs, it could pose risks to them, getting a job, maintaining health insurance, all these things that, they may not be aware of when they first do it. So it's important that they're educated about, that what you're putting out there is out there. And so as long as you're comfortable with that, then you can do it. Also, many of our AYAs wind up over-relying on online sources. So it's very easy, it's convenient, they start looking things up. But then they might not tell their physician or their care team that they've been looking up these things and trying different things. And it's really important that they have those discussions. So they might think, oh, I read online that this side effect will go away in a month, so I'll just wait on it. And then they don't talk about it with their physician, who might have said, hey, we actually have something we can give you. You don't have to suffer for that. Or they might be trying other things as remedies that might counteract with some of the medications that they're on, or that they're not aware of. And so it's important that they share that information and have those discussions. We also see too, this is part of the sort of coming to that first diagnosis, is that, when you're young, you don't think cancer is the first thing in your mind. And so they might actually delay seeking care because they're like, oh, it must be, pneumonia that I have that's making it hard for me to breathe. It's not, I have a tumor in my chest. So it's really important that we encourage our AYAs to even, I think they can be active online, but bring that information to their care team too. Also, some of those online resources are not necessarily checked by doctors. So I think an example here is like using the WebMD checklist, right? They have a great checklist online. You put your symptoms in, you put your age, your gender, and it gives you a list of things in like sort of order of likelihood that they might be. But if you're not actually discussing that with a doctor, you might have a lot of anxiety about what those order of likelihood is, and it's unlikely to actually be your diagnosis, because it's not like it's a physician. It's just meant to be a tool to give you some ideas. And so I think people, there's a balancing of the insights you can get from these tools and, anxiety and misdiagnosis from them. So how do we help our AYAs identify credible online sources? So here's an acronym that is from a librarian services called the CRAP method, which I think our AYAs would like. And so it's really the idea of using this method to figure out to what extent does this source seem credible. So the C stands for currency. When was this information published or posted? When was it last updated? Is it current enough? R is reliability. Is the information supported by evidence or citations? Has it been reviewed by anyone? Is there a sponsor listed there that says they've reviewed this information? And is the language unbiased and balanced, or is it very much skewed towards one sort of either all or nothing type language? A is authority. Who is the author, source, or sponsor of this material? Are they an authoritative resource on the topic? What credentials or qualifications do they have? And are they reputable? And last is P, the purpose. What is the goal of the source? Why was it created? What is it trying to do? Is the information factual? Is it unbiased? Or are they trying to sell you something? Are there 4,000 ads on the page that you can't even read the information because they keep popping up? So to help you understand that, so the most likely to be credible are sources that are up to date, within the last couple of years at most. They have citations for any claims that they make. They might be citing medical journals, or perhaps citing large organizations like the American Cancer Society or the National Cancer Institute. They might be on a government agency, a hospital or a medical center, a nonprofit organization like Crossroads for Hope. We would assume that information is all very credible, right? If they have scientific journals, so those are credible sources of peer-reviewed information. So other scientists have read that and they say that this is an unbiased contribution. And if they have any facts listed, if you were to actually Google that fact, you could find other sources that will also back that up. So a fact is not just a fact on this website, but you found it in other places. If they're really outdated, you're going to start to question how relevant is this information right now. If they have little or no citations in any of their pages, you're going to be a little worried. If they make unrealistic claims, like you can cure cancer in 5 days, probably not, right? Or grow your hair back overnight. It's unlikely that that's a realistic outcome. Promoting products, that's a big red flag. So certainly there are definitely reputable websites that promote products, but typically when people are trying to sell you something, they're only showing you one side of the coin, right? And they're not giving you the unbiased information. Personal opinion versus fact. So many of our AOAs read people's opinions and believe that they are a fact. They are not, right? Opinion is different than fact. And so sometimes we have to actually help them think through. Is that just someone talking about their experience, which can be helpful and relevant, or is it a factual, objective information? I think this is where personal blogs and other places like that can be both a great resource for folks and also challenging for people to navigate. So because some people offer that this worked for me, and that's wonderful that they're sharing that information. And I think we encourage, if it seems like a reasonable and safe approach, our AYAs to try it, but it's not going to work for everyone. And so it's important for them to also know, like, just because it worked for one person doesn't mean it's going to work for me. And also thinking about biases and how this information comes about. So if it's from if it's funded by a particular company that is trying to sell products, then you're more concerned about the funding, the bias in the website, versus if it's funded by like the National Cancer Institute or the American Cancer Society. That's going to be unrelated to what the results are that they're presenting. So how do we help our AYA survivors navigate the use of technology throughout the treatment trajectory? So I think first and foremost is really important to help them navigate and identify credible sources. So many of our AYAs actually might get some of this in schooling now, because the internet is so, around for everyone, that they're starting to have computer and online courses in schools teaching them about identifying reputable sources. I think when it's about your health and about something as serious as cancer, sometimes it can cloud their judgment a little, though. So it's helpful to remind them of how to find those reputable sources. It's also important to discuss the pros and cons of different platforms. So I think figuring out how they want to share information. Do they want to share it on something that they're using every day, like Instagram, or are they wanting to keep that more private and maybe just send an email to a certain group of people about things? So helping them decide which seems like the right place for them, and then really encouraging them to reflect and know what works for them. So we often find that their technology use might influence their mood or behavior in different ways. So sometimes when we're looking online and we're comparing ourselves to our social feed, there's this concept of social comparison where you can either do an upwards comparison where you're looking at people who seem to be living this best life much better than yours, some sort of standard that's probably unattainable. And that usually makes you feel kind of bad about where you're at or what you're missing out on. Or a downward comparison where you're looking at some people have it worse off. And you're like, I guess I'm not so bad. We actually see this when our adolescents and young adults, sometimes they come in and I'm thinking of a particular young woman who had thyroid cancer. And she was really struggling emotionally with it. She had surgery and was just in surveillance. But she came in and she was like, I can't complain. I see these guys getting chemo and losing their hair, and like mine's like the good cancer. But yet her experience is real and her feelings are valid. And so her comparing to others made her feel almost like her feelings weren't right because she didn't have the right kind of cancer. And so it's important to let people experience what they're experiencing regardless of the relative context. And then it's important for our AYAs to know, like, does it help me to look online, or does it make me feel sad when I do that? We had a young breast cancer survivor who her treatment group had encouraged her to go to a support group because she really wanted to meet other young women. And so she went to an online group, and then someone in the group passed away. And that really hit her, that she was like, oh no, like this, it made it feel very real to her because she knew that person. And so then she decided she couldn't go back to the support group. And that was for her own mental health, that she couldn't the benefits of it didn't outweigh the concern and the fears. And so it's really important to work individually with our AYA to decide what makes most sense for them, what feels comfortable, and what is too anxiety provoking. And someone who is spending too much time online, I think many of us, if anyone has children in the room, I've tried this with them, is to try to experiment, help them experiment with just going offline for a little bit and seeing how that feels. So getting them just to agree as like, let's just try this for a day. It doesn't even have to be, even start with, we're going to just spend 20 minutes not using our phone, right? And seeing how that affects their moods. And I think many people are surprised by the influence that their being online all the time has on them. And so, having these sort of offline periods can be really beneficial. Also encourage them when they find information online to discuss that with their treatment team, with their caregivers, whoever else needs to know. It's important to talk about. And then, I'm thinking about if you're a caregiver in the room or someone who's working with AYA, it's important to model appropriate use of technology. So I also think of this, you go out to a restaurant nowadays, you see a family sitting together, you might see all of them sitting there on their phones, right, looking down instead of engaging in conversation and enjoying just being out. And so I think if you are a caregiver, it's important to also kind of walk the talk and really do what you're kind of suggesting for the AYA too. So I want to just walk through a little bit of a research example. I am a researcher at Rutgers Cancer Institute, and of how we use technology in our research to try to make our interventions, our mental health interventions more available to our AYAs. Just very briefly that I'm going to talk about a research study we called Managing Your Health. And as I mentioned earlier, the majority of our childhood cancer survivors will experience at least one late health effect from their cancer treatment. And therefore, our guidelines from the Children's Oncology Group recommend that they receive lifelong risk-based care, medical care tailored to the types of treatments and exposures that they had as kids. And what we find is that there's a major gap in the transition from parent-guided, pediatric-oriented care to adult self-management of care when they become a young adult. And so we did some work with interviewing our young adults, asking them about what are the biggest barriers. So here is just an example of some of the top barriers that they listed. One is just not knowing what happened to them. They had treatment a long time ago. They don't remember all the names of the drugs and the things that they went through. The second, and we heard this if anyone was in the Navigating Transitions session right before this, is that they develop really deep relationships with these providers, and it's difficult to move on to a new provider. These are the people that they often view who have saved their lives, and they really may have known them for many, many years. And so it's difficult to try to start new with someone else. There's also changing family and peer relationships. So family usually still remains very involved in many of our young adolescents and young adults' lives, in their medical lives. But they're developing autonomy from that family, and peers are becoming more important. They're maybe starting their own families. And so that shifting dynamic makes it difficult to navigate the transition from the parent doing it all to the young adult. There's also a lot of emotions about this transition. Besides leaving trusted providers, there's a lot of anxiety about future health because you don't know what's going to happen. And it's sort of there's fears in the back of your mind about what health effects are coming my way. And then, of course, as we talked about AYAs, there's all these life transitions that are happening that are much more the focus of attention. They're really focusing on, all right, I'm finishing high school, I'm going to go to college or trade school, I'm going to start living on my own, I'm going to get a job. These are things that they're thinking about, and their health is sort of in the back of their mind if there's not a major problem. So we developed an intervention called Managing Your Health, and it's a self-management education intervention. So you can see here we have 5 educational modules that we put online as a way of making it more accessible. And then we also, as we've heard a lot today about the real need about connecting young adult survivors to each other, we developed a peer mentoring aspect. So we link them up with another young adult survivor who is, doing well in managing their care and can offer some advice and tips about how to do it. And so they meet for 6 sessions on telehealth. So they do a Zoom FaceTime type call, and they go over these 5 of the weeks are really kind of devoted to these 5 topics, which are really like understanding your healthcare, navigating the very complex health system that is the United States adult healthcare, thinking about how families and other significant others play a role in your healthcare going forward, the emotions about your health, anxiety about the future, and staying healthy or healthy lifestyle. So we ran our first group with that online module, and people really liked it. They mostly really loved having another young adult survivor to talk to about these things, because they didn't know anyone who had to go through this also. But the one feedback we got was that we wish it was a mobile app, because that would be a lot easier on our phones. And so then we developed this mobile app. So I'm just showing you a few screenshots here. We try to personalize it to the individual by having them on board with some questions about how they're doing in different areas. And then we have those 5 modules again, and this is just some pictures of how we display the information, and they can access their peer mentor right through the app too. And so we are right now in the throes of testing that app and making sure that it's helpful and useful to folks, and then we hope that it'll be available in the future to people. In conclusion, really, as technology is used every day by all of us, it's really used, again, by our AYAs across the cancer continuum, and there's a lot of value to it. There's a lot of ways that it can help connect them and empower them and get them information that they couldn't have had access to 20 years ago even. But we have to be cautious. There is a lot of misinformation out there. People can become distressed in response to seeing some of this, or in people's response to them on social media, sharing this kind of information, and there are real privacy concerns. So the goal is to try to harness technology as a tool, but also not to neglect our non-technology resources. So don't forget about our in-person support groups. And we heard earlier that many of these programs are offered online, but there's also lots of programs offered in person, and we can refer people to try those too. And then I think another important piece is to always be ready for something to change with technology. So even things like TikTok weren't a thing that not long ago, right? Or we heard about, stupid cancer earlier, it was like MySpace, right? And then we're constantly changing. And so we have to try to keep up, because typically our AYAs are the early adopters of technology. And so they're the first ones to try everything out. And so we have to try to stay up to date so we know what they're doing, and the pros and possible pitfalls of it all. Well, thank you all for your attention today. It was a great discussion.